Hi, my name's Sophie.
Malolei, my name is Amelia. I'm a community connector.
Talofa, my name is Sene. I'm a dentist at the Christchurch Hospital Dental Department, and I'm glad to be here. I mean, I wasn't always a dentist. I didn't have all the, knowledge that I have now when I was growing up. I was probably one of the children and teens that needed 4 or 5 fillings every year. I know, every year I went to the dentist. But I think it was just probably something that my parents didn't really push, or place a lot of emphasis on. My mother had dentures, so, it was just different. I don't blame them for it, but anyway, my teeth are very, very heavily filled from a young age, so now all the wear and tear, they're starting to deteriorate. So, you always think it's just, not you guys always think, but lots of people think that it's just a poor sort of person thing to have bad teeth, but even lots of wealthy people do as well, because they just don't like going to the dentist, don't place priority on it. But yeah, have one outstanding thing to do if it makes you feel any better. I had a great dentist though when I was a teenager. Always really lovely, was never uncomfortable in the chair, always did really good local anaesthetic and made sure I didn't feel anything, and so I was never worried about going. So it made me, to be fair, I didn't drop into dentistry. I did a few things first, but I'd had a lot of experience in it as a patient. So I think that actually helps me as a dentist though.
Yeah, I definitely think if you were my dentist and you shared that with me, I would feel much more comfortable. Because growing up, every single dentist I ever had, they'd be smiling back at you, and all you can notice is their teeth, because it's the whitest, straightest grin you've ever seen, which can be quite intimidating, especially when you're lying back on a chair and they're all up in your mouth.
Yeah, absolutely. And people often, when they're like, I say what I'm doing, and then they're like, oh, okay, and then they have the rest of the conversation like that, but there is no judgment at all, been there, done that. Like I said, my mother had dentures, so yeah, no judgment, and just like to do what I can now that I have the skills to do so,
Okay. Yeah. For example, Sophie was saying, is if I encounter a dentist, having that conversation, her experience or his experience with me, it will make me feel comfortable. But growing up in Tonga, we don't go see a dentist. I didn't know the difference of the dentist and the doctor until I arrived in New Zealand. So any pain or anything that we have back in Tonga, there was natural medication was given to us, and it was okay. I think as a little girl that it was okay. It just take away the pain. Until I arrived in New Zealand, that's when I first attended dentist. It was the scariest thing that I have to do, lie there looking at all the machine and everyone looking at me doing all things, and you have to close your eyes, just wait to hear the drill and all the work that they did for me. It was really a scary thing for me. But as I become, and my teeth is not the best, I almost lost all of it because it's just something that I don't focus. I focus on other part of my body that have ache. But if I have a toothache, sometimes I do the natural treatment that I grew up with, and it will take away the pain. But I didn't realize the effect of the tooth problem is still there until it's a bit too late. They all remove all my chores tooth. But I think to have an awareness of what pain and what treatment out in the community, that would be really, really good. Have a conversation with the children that, you know, it's very important to look after their teeth.
I think that's a great point. I think it starts with the children and then everything else will fall into place.
Yeah.
You know, I think that's always a good starting point.
What's probably the best way to approach your dentist about any fear or like anxiety of the experience?
Yeah, so I think that, to be honest with you, as well, I've worked in private practice and I've worked at the hospital dental service and I've worked at the community dental service. So everywhere, it's huge. Nearly every single person that jumps in the chair will say that they're nervous, but I do think you need to communicate it. Just if it's quite a severe thing for you and you're getting super stressed about it before you even go there, I would probably flag it to reception. If things are very, very extreme, then GPs can refer to the hospital. They don't. It's a funny one with anxiety. Unfortunately, you know, they're just